All right, guys, welcome in on this Friday afternoon. This is Weirdy Day, and special episode. I have my wife, Sarah, and Dr. Mark Stephany. We will cross post this on our channel, Crypto Conversations with Joe. So I know your time is scarce, Doctor. So we'll hop right into it. How are you doing, sir?
I'm doing great, thanks. I'm happy to be here, especially being on a fellow Minnesotan podcast. So it's delightful. Thank you.
Absolutely, gotta love the Bitcoin meetups. Went to my first one last month. Met Brandon Quidham and Blue Collar Bitcoin Boys. So that was awesome.
Yeah, those meetups are like nothing else. I mean, to be hosted at a whiskey distillery by a Bitcoiner, is pretty remarkable. It's a great experience. I think it's probably unique in that sense across the nation. So certainly would have anybody recommend stopping by. That's for sure.
All righty. So as the host of the most, I will start with the intro here. So question number one, what is your Bitcoin and healthcare origin story, and what capacity are you employed in healthcare right now?
Well, the Bitcoin origin story and the healthcare medical side of things origin story certainly formed separately, converged later on. I'm a hospital medicine physician, have been so for the past 11 years. And that's my full-time job currently. My Bitcoin origin story started in 2017, January 1st, actually. I was reading a article in Harvard Business Review, oddly enough, on New Year's Day, and I talked about blockchain, and I thought, well, this is something interesting, potentially applicable to the healthcare industry. And so to me, it had the sense of being similar to the internet, and so something as big as that. So I spent, better part of 2017 being swept up in the cryptocurrency ICO craze, only to be spit out the other side, in 2018, 2019, and really being disillusioned with the whole thing. But circling back there towards the end of 2019 and seeing that things weren't going away, Bitcoin was still there, and kind of plateauing with some resurgence, revisited it and understood that if I was going to get back into this whole space, I wanted to better understand money and the origins of money, why we use it, what makes it good money, the history, the financial aspects of it. And so just spent a lot of time reading about that before even really getting back into it. And it was a terrific education, and certainly recommend anybody to do that, to study the history of money, because it's incredibly fascinating, and it goes the spectrum of philosophy to history to economics. It really touches on so many facets of life. And it's obviously something ubiquitous to all our experience. And so to better understand it, I think really only serves you as an individual and as a citizen. The convergence with Bitcoin started a few years ago. And within, at least on social media, Bitcoin, Twitter, you got a sense of people changing their frame of reference with regard to their health. And they talk about this low time preference, meaning focusing on future thinking. What can I do now to plan for the future? Not being caught up in materialism, not being caught up in things that aren't going to be beneficial for oneself in the future. And so you contrast that with high time preference thinking, which is, arguably a hallmark of a contemporary society where we buy everything on credit when we want to get all the biggest, fanciest toys, borrowing beyond what we should, and really focused on, the very worst sides of carpe diem and wanting to seize the day just for the sheer bliss of everything. And so what you saw were a lot of people wanting to change that attitude and start focusing on their health. And you would see tweets from people saying, I quit drinking after discovering Bitcoin. I quit smoking, and I started working out again and eating healthier. In which, as a physician interested in those elements of health, I really took note of that and tried to figure out what it was about Bitcoin that allowed people to have this change in mindset, this change in behavior, because a change in behavior is everything. That's the really what we're after in all of health and all of medicine is somebody to change how they approach their health in order to get better outcomes. And so, would you like me to touch on why I think there's a connection between Bitcoin and behavior choices, or is that something for
Absolutely. Go ahead.
again? Whether it's just this community sentiment, I think is a big part of it. I don't think there's anything intrinsic to Bitcoin that makes somebody say, "Hey, um, I'm gonna eat better today." So it's a community sentiment. So it's rather pervasive, I'd argue, within at least social media, Twitter, um, talking about leading healthier lives. And so that I think permeates the individuals who come into the space and they see that. Additionally, Bitcoin is a long-term play. It's for those of us in the United States, at least. For most of us, Bitcoin is a savings vehicle, and so when you put money into it, you are planning for the future. And that emphasis on saving is something that I think a lot of the younger generations are missing. I mean, why would you save? You're not going to get any interest in a bank account, and you've probably got more expenses than you can keep up with. And so the ability to save is so challenging. And so that saving for the future um, being challenging, how could you even, a lot of people aren't even doing it in the first place. And so with Bitcoin, you can save pennies, you can save very fractions of amount. And so the ability to do so is a little bit easier. And again, that shift in mindset of, okay, I need to be thinking about 5, 10, 15 years from now, I think translates into other aspects of one's life. And so if I am saving for the future, what else can I do to plan for the future and make sure that um, it's as ideal for me and my family as possible? And so one of the things that's talked about within the Bitcoin space is this future self thinking. What would my future self think about my choices today? And I think that's an incredibly powerful thing to ask yourself, because so often we focus on the past. And a cliche interview question is, what would you go back and tell your 21-year-old self about, how to plan for the future? And I think the question should be, what would you tell your future self about what to do right now, and make your decisions based upon that? Because a lot of times when you think in that manner, no, I'm not going to reach for that second pint of beer. No, I'm not going to pick up smoking again. No, I'm not going to go party again tonight, because I know that in 15 years from now, I'm going to regret probably having done that, given the fact that I'm maybe 30 pounds overweight, my arthritic knees, and my loaded up pill box. It will not have been worth that, those downstream complications. And so those two main factors: one, future self thinking, and the ability to save, as well as the um, community sentiment and support around trying to lead a healthier life, I think, are the two main reasons why there's overlap between Bitcoin and lifestyle changes.
Ooh, awesome. Yeah, as Bitcoiners, we always, as mentioned in your book, we always talk about low time preference, kind of delaying gratification now to set up for success in the future. So that's awesome. Sarah, anything to add on that one?
Oh yeah, I mean, I love this conversation. I think it's what we all need to be thinking of. For me, it's self leadership, right? So to be a leader, you have to have vision. I really believe that. You can be a good manager without vision, but to be a leader, you really need to have a bigger picture on the horizon in the future. And everything kind of comes back to realizing that vision in the day to day. So I'm not a Bitcoin expert. My husband Andrew is much more into the Bitcoin. I've been orange pilled, so to speak, right? But like it's not. What was
me and
that?
Mark got the Bitcoin connection, so that's like a connection for life. And then you guys got the medical. We all have the medical connection, so that's kind of cool.
Yeah, but like I've heard you. Bitcoin, there's proof of work, right? And I think of the problems in our healthcare system. The proof of work piece is kind of we miss that. So people want to work around. They want to quick. They want to feel better without really changing, without putting any skin in the game. And so that's how I kind of connect the two. It's like our fiat system. It's there's not authenticity to it. There's no real proof of work, and it's crumbling, falling apart. That's going to inevitably come to an end. And I kind of see a similar fate for the healthcare system if we don't turn and change the trajectory here. I feel it is. And people are kind of waking up to that. I think and patients themselves, I think, are a lot. They see that too. They're like, this isn't really doing what I want it to do for me. And people are disillusioned with the care they receive. I think a lot of times they want something else, but they don't know how to get it. And so I think this whole conversation about leadership, self-leadership, how to whether it's your finance, because it's just a general principle that's going to affect every area of your life. It's going to be your health. It's going to be the way you parent your kids. It's going to be how you spend your time. It's going to be how you prioritize things in life. It's going to flow through all your finances and every other area, even in your relationships. So I think this is so core to really encouraging people to be successful people who they're their own leaders. And I loved your book, Mark. Thank you so much for joining the show too. I really enjoyed your book. I read it in a day. I couldn't put it down. I just, got it. It was wonderful. And it just really resonated with everything that I feel passionate about. And I highly recommend any listener out there who has not read this book, you got to get your hands on this book and read it. It's very motivating, and it's succinct. It just gets right to the heart of the issues. And so thank you so much for that.
Thank you for the kind words, Sarah. I appreciate it.
Yep, and I have a screen share. You can pick it up on Amazon there, and I got mine right here for you to sign there, Doc, when we meet up in person. But
absolutely, it'd be my pleasure.
So number one, we got going. Let's see. Next question. I think it's the only question I wrote. Here, hold on. I'm going to try to reword this one. So, Dr. Mark, when did you realize? I wanted to say, when did you realize healthcare was a scam? But when did you realize it wasn't, the needs, it wasn't always cracked up to be, let's say that.
Yeah, I don't think healthcare is a scam per se. It's getting the results that it's designed for, and the results that it's designed for are not to optimize health or to allow somebody to be healthy and avoid healthcare or avoid medical care in the first place. It's designed for throughput, meaning more procedures, more medications. That's what you can bill for, and that's what you make money on. And so that's what it is, and it serves its purpose. And I don't think, it's not something that, again, I think is a scam per se, but rather you cannot rely on a system that's not designed to provide you the health that you deserve and that you need, right? It's designed to treat disease. It's not designed to promote health. And so I think while there's this veneer of leading healthier lives within the medical establishment within the United States, it's just that it's a veneer. And a part of that's because of training. Physicians aren't historically trained in lifestyle changes, nutrition, et cetera, nor is it something that's readily reimbursed for. And so there's a lack of information, and there's a lack of financial incentive. And so therefore you're not going to get it. Is the medical system good for treating acute care and for cancers, trauma, orthopedic things. Yes, absolutely. And I wouldn't want to go anywhere else for that. But when it comes to specifically, and that's what I emphasize in the book, specifically the chronic medical conditions like heart disease, diabetes, high blood pressure, high cholesterol, and so forth, those are conditions that are primarily the result of our lifestyle choices. And they are treated with primarily medications within the current medical system, and therefore not addressing the root causes for their development. And so it's been 5+6 years now in my career where I've realized, hey, I'm seeing the same exact thing in the hospital system day in, day out. And yes, I'll give you antibiotics. Yes, I'll put you on a blood pressure medications and statins and so forth. But there's a good chance I'm going to see you again in the hospital for the exact same thing, right? And it became frustrating from a professional standpoint. Am I really doing any good for these individuals if they're just going to delay the inevitable here, if they don't change what is causing this thing in the first place? And so it not only was it a professional dissatisfaction, but there's also from a moral standpoint, it felt a little ambiguous to me, not being able to emphasize those things that I think are most important. Somebody's getting pinged a lot over there. I'm not sure.
Yeah, it's not me, Andrew. I think it's your phone.
About that. Alrighty. Sarah, anything to add with that one?
I mean, I agree. I agree with everything you said, Mark, about, yeah, I mean, if my kid had some crazy, I mean, we're going to the clinic, we're going to get care. They do a good job. The thing is the primary care too. The primary care is not really primary prevention. What they call primary prevention, in my mind, really isn't primary prevention. It's kind of secondary prevention. So we do screenings. Well, okay, screenings are a good thing, but how about changing lifestyle so you can kind of prevent that even before, catching things. So it's downstream thinking. We're not intervening, I think, at the appropriate step, which is people's basic day-to-day lifestyles and diet, nutrition, exercise, all of that. And there's, like, I agree with you, there's no time for that, and what really motivated me, so I'm a nurse. I was an inpatient nurse and, a hospital inpatient in Gen Med floor for kind of what they call the armpit of the hospital, because it was just, that's what it was. It was, everybody was there, end stage or close to end stage of chronic medical conditions. And it broke my heart. It broke my heart to be the bedside nurse and watching people in such poor condition. And I knew, I'll see you in a month, because it would just be like, these people were coming back, they're not going to do anything different. And I didn't really feel like there was a lot of conversations about things that they could do even. And that's what motivated me to pursue my graduate degree, because I really thought, if I can have an impact before they get to this stage, that's really what I want to do and be passionate about. And then I went through my program and I learned how to prescribe medications. That was my education. And I got to the end of that, and I had the letters behind my name and my license and everything. But it's like, this isn't getting me there either. And so that's where I really, just on my own, really pursued people who are doing things a little differently. And, behavioral health coaching and everything, that's my jam. I did addiction medicine and addiction counseling before I was a nurse, actually. So I had those skill sets of motivational interviewing and then talking about people's, and, getting to them to discover their own priorities, their own value systems. And then, they were the ones that spark was ignited inside them. And when that happens, then the transformation happens. And that's really what I wanted to do. But yeah, going through it, the medical education system is not preparing people who even want to do general practice, primary care, practice. In my mind, it's not really, we're missing the mark. And so anyways, I just agree. And I think that there is a strong push though from patients themselves. I've seen that a lot of times people will have conversations like, I don't want to be just taking more medications. Is there something I can do? Absolutely. And it's a great adventure to walk with somebody in that kind of way. It's a different type of patient provider relationship. I feel very much like a coach on the sidelines and a cheerleader, and it's exciting. It really reduces burnout. I think in the contemporary medical model system, it's a recipe for burnout. You are a cog in the wheel, and you will. It's tough. I have a lot of respect for people who are doing their best in that system. I couldn't sustain it. So.
Right.
Amen. Well, move right along. I guess as a moderator, I got to do my Joe Rogan thing here. I will side note, I did have to learn to read the book, and I read the whole thing, and it was awesome as well. Nobody laughs at my jokes. All right. For listeners who aren't familiar with lifestyle medicine, what's your kind of short elevator pitch on what it is, and can you kind of compare contrast with traditional Western medicine?
Absolutely. So lifestyle medicine is in an accredited training. There's the American College of Lifestyle Medicine, and the certification is offered to kind of the spectrum of provider, from health coaches to nurses to PAs and physicians. And what it focuses on are the social determinants of health, specifically lifestyle factors, including nutrition, exercise, sleep, stress, connections, relationships, and avoiding harmful substances. And so it focuses on all of those pillars of your lifestyle and how it influences your health. And so the training, and then in turn the practice is focusing on each of those and working with individuals, groups, employers, whomever, to learn how to address those and improve them, with the understanding that they are the primary driver of health, rather than, say, genetics or medical care or the environment. So it is focusing on that, big portion of one's health. You contrast that to Western medicine, of course, is much more prescriptive. It looks at the end state of a given pathology or condition, and what can we use from a pharmacotherapy or procedure, surgical approach to treat and manage that disease. You can also contrast it to functional medicine. Functional medicine is similar in the sense that it does focus on some of those elements like nutrition and exercise, stress, mindfulness, things like that. There's a heavier emphasis in functional medicine on laboratory evaluation, such as like checking TSH, thyroid stimulating hormone, and inflammatory markers, things like that. While that is taught and can certainly be done within lifestyle medicine, it's not as much of a first step, nor emphasized initially, because in the end, while we are tracking those markers, usually it's kind of funnels down into looking at those things, meaning if you're not eating well, if you're not exercising, if your sleep is poor, drinking a lot of booze, I can tell you already that your labs aren't going to look good. So I probably don't need to check them, right? I don't need to have you spend hundreds of dollars on these labs to tell you what we already know. And so from there, you can kind of funnel down into, once you've made those changes, trying to get more granular in the future. But with the new client, I don't need them to go get all these obscure labs done in order to start making progress. Obviously, basic things like lipid panels and A1C, renal function, those are important for anybody, no matter what area of healthcare, medical care you're trying to provide.
All righty, Sarah, what do you say?
Yeah, I thought that was a really nice overview. Are you going to? I'm just curious, Mark. Are you going to the conference this year, ACLM?
I have to work, but I'm probably going to do the virtual sessions.
Yeah, good deal.
So we'll hit number 5. How do you see functional versus lifestyle medicine? Are they same, different? Does it all kind of blend together?
As I was just saying, there's definitely some overlap, but I think that there's less of an emphasis on that laboratory evaluation up front from a lifestyle medicine approach. And lifestyle medicine also incorporates a broader scope, looking at, say, sleep, stress, connections, avoiding harmful substances, in addition to nutrition and exercise. It's not to say that a functional medicine practitioner doesn't do those things, but it's baked into the training for the lifestyle medicine.
Cool. Sarah, any questions?
No, I mean, I think I agree. I would say maybe the difference, lifestyle medicine is entirely accessible to everybody. And I think that sometimes functional medicine, it can be quite costly to get these large panels done. I think if people have worked on the basics, like just what we talked about, those 6 pillars, right? They've optimized their sleep. They're getting good nutrition. They're getting an exercise plan, and they still have some pervasive symptoms. Something's not quite still going right. I think that can be very helpful in terms of the next kind of level of workup. Maybe there is something we can do. Maybe there's a genetic, mutation on a receptor that we can't, that would be helpful in understanding. Maybe there's a cofactor that's missing, but that really gets into the weeds. I'm not an expert on functional medicine. I'm interested in learning more about it. I think, understanding the cellular metabolism and all of those pathways are very key. But I really like how accessible lifestyle medicine is, because there's so much that we can just do. Anybody can do from any socioeconomic situation. And a lot of those things, you can go ahead and get a test and it's information, but then I always think as a clinician, well, what am I going to do with the information? If it's not going to really change my treatment plan a whole lot, what's the net benefit of that? If it's really going to maybe shed some light on a key area that we really need to optimize that I wasn't aware of previously, and it would change the treatment plan, I think that's good. So it's really a nuanced sort of case-by-case individual thing. I think they go very nice, complement each other. But I would agree with Mark in understanding lifestyle medicine is that general foundation. And if you need to build or investigate further in a specific area, then it's nice to have those resources too.
Awesome. Learning a lot here. So we'll move on to number 6 then. So what was it like writing your book? Have you been any previous writings, or what was the impetus that made you even want to write the book?
I've always enjoyed writing just as a casual hobby. That being said, I stopped writing for years, once I was out of medical school. But I actually started a literary and arts journal while I was in medical school. So it was, pieces that had some health, humanistic elements to them. And that idea came from something that happened in my life that was a huge impetus for pursuing medicine. And that was reading the books of Richard Selzer, who was a general surgeon from Yale, who who I think practiced up until his early 50s and then felt called to start writing. As he describes it, his father was a town doctor in upstate New York, and his mother was an opera singer. And so he says, I fulfilled kind of my dad's legacy by becoming a doctor, but then I felt the arts from my mom's side pull me into writing. And his words, his writing were just drew me in and like captured everything that I loved about anatomy, physiology, about medicine, about being compassionate and empathetic for people. And so starting that literary journal was kind of an homage to what he had given me. In addition, that the book Sovereign Health was a part of that too. I said that about 5-6 years ago, I started to become disillusioned with my career in medical care in general, and so it all came together 2019, and I thought I've got to get these ideas down on paper. And so I would get up at 5 a.m. and start writing, and I got a lot done. COVID hit, and so everything got sidelined for a while, but once things started to settle out, from that standpoint, I came back to it almost with a even further motivation to finish it, because what the pandemic revealed was that it was increasingly evident you can't rely on a system to provide you with better health. You may be able to rely on these acute medical conditions, but what we were seeing from the people who were hit most hard from COVID, really needed this information the most. And so I felt like it was my duty to be able to write this, to tell people that the onus is on them. And while it's scary and daunting, it's also empowering. Again, this is not to say you should not seek medical care, that that it's shameful if you need medical care, not in any capacity. This isn't about malevolence in any way on behalf of like the medical system. It's just, again, like a very black and white situation. It's not designed to prevent you or from getting, let alone optimally managing your diabetes or your heart disease from a lifestyle standpoint. And all of these organizations, the ADA and the AHA, the cardiology groups, their number one step before medications is lifestyle changes, right? And no, this isn't about if you're having an acute MI and what you need in this moment. It's about preventative care, and it's about managing the risk factors. And their number one recommendation is lifestyle factors, yet you get zero education on any of that as physicians, let alone as patients. And so I could not in good conscience look at my patients and say, hey, you need to do these things and best of luck to you, So I wanted to be able to fill in that gap where there was no support for individuals. And so hopefully the book is able to provide some component of that for people.
Excellent. And if you guys have ever seen Saturday Night Live, I just want to do this for you guys. Whoa, hey, Dad. I think we got ourselves a writer here. Is that Bill Shakespeare over there?
Very good. Thank you.
Sarah, you got any questions about the writing?
Oh, I mean, it's aspiring. That's great that you. I think a lot of us do have some good ideas, but we never take it to the next step to actually put pen to paper. And so that, yeah, good on you for doing it. Again, I really enjoyed the work. I don't know if we have a question about this, but one concept that you talk about in your book is health capital. And I really love.
That'll be coming up.
Is that coming up? Okay. Yeah, it's just that whole concept is so vitally important.
Yeah.
Well, we can jump ahead if you want.
No, I'm the host with the most, so I'll just go down the line here. Actually, I'm supposed to. That's a good segue. Do you want to talk about health is capital?
Sure. Yeah. In the book, I draw a parallel between the world of finance, investing, money, and your health. And so this idea of investing in yourself, and you've heard of the word capital, business capital, and so that's all the the assets and the physical assets that a business has, and building that up over time. In addition, there's something called human capital, and so that's your employees within a business, and very much an HR focused topic. And if you have better employees, you're going to be, have a better workforce. That's will lead to better productivity and ultimately better business revenue. So the idea applies to oneself too, and your health. And so this concept of investing in yourself and allowing it to pay dividends for you over time. And so within investing, there's this idea of dollar cost averaging, meaning if you were to buy a stock, say Amazon stock, and you started investing, $10 a day back in 2009, whatever. And regardless of price, you just keep putting in $10 a day, and that will, that investment over time pays off for you. Same concept for your health. Every time that I have a good meal, every time that I go biking, go for a run, or work out, or choose to avoid certain things that are going to be bad for my health, I'm dollar cost averaging into my health capital. So I make investments in my health, knowing that not only do they provide benefit for me right here, right now, but they're going to pay dividends for me over time. And so it's an investment in the future as well. And investing in your own health capital is beneficial for you, but it's also beneficial for your family. It's beneficial for your employer. So it's a win-win situation.
Awesome. Any questions, comments, rebuttals, sir?
No, I mean, I just thought that was such a key takeaway for me. Well, there's a lot of really good takeaways in the book, but I like that concept a lot. For me personally, I did not have that understanding. My personal story is really, I battled with addiction in my teens and 20s, a pretty severe drug addiction, and a lot of just real poor health behaviors. And I was living for the moment, very much. I mix these concepts up. What is it? Low time, high time.
So
Which
that
one
would
is?
be a high time preference.
Yeah.
Would be, we like to do low time preference.
Right. So, I had all, and I think a lot of it, the more we grow older, we that sort, you do kind of like, whoa, wow, I mean, my choices are catching up to me. And so everybody sort of comes, I think that's a natural process of aging too. But I've seen young people with a really good head on their shoulders too. So I don't think this is necessarily something that you have to arrive at just because you're getting closer to mortality. I think it's a mindset. It's a culture shift. And there are a lot of cultural ideas that are not necessarily very helpful for our health too. I grew up in a very rural area, and it was, drinking a keg of beer in the back of the pickup truck in the field because there wasn't much else to do, and there was a lot of high risk behaviors, and that was the culture that I grew up in. And I didn't have a lot of time for people who, I kind of rolled my eyes at, people who, what are you, a granola person? You're a tree hugger. You're I mean, I didn't have a lot of respect even for other people who were making healthier choices, and investing in their health. And so I don't know how I came around to that, because I've definitely done, my life is so different, and my outlook and my priorities are so different than where they were at one time. But I also can relate then to people who are still in that mindset. So I'm like, I get you. I totally get you. And you don't have to stay there. And at one point in my life, I smoked 2 packs of cigarettes a day. It's like, I have gone so from way over on one side of the spectrum, and I'm evolving and learning and growing in time. And I'm passionate about that. Everybody can change, have a mind shift, and come to a different understanding. And I think that sometimes it just takes one person and a pivotal conversation to help people maybe on a different path, or to be open enough to kind of thinking in a different mode. And so, I like the idea of health capital. I think it's sometimes it's hard for people to get there, to see it. But yeah, definitely important.
Well, you don't. People often think of health as this luxury that you don't have time to think about it, and you need to focus on other things. What I try to emphasize to people is that whether you are some young guy just graduated from Stanford or want to be the next big Silicon Valley entrepreneur, or you're a farmer who just really is concerned about your farm and your family and that very tight knit community, health still remains foundational for doing those things effectively, right? So you are not going to be the best entrepreneur if your body is not functionally optimally. And I know that you may think that it is, and that you can get away with doing those things, but just imagine how much better you would be if you were not, right? And so that's the argument that I have for somebody like that. But then on the other side, somebody who doesn't think that necessarily health is imperative to their day-to-day life, again, it still is the foundation for your interactions with your family, with your friends, and your ability to do the work that you take pride in. Again, we see so many individuals whose jobs, whose careers, whose efficiency is affected by their health choices. And I'll be able to put Band-Aids on that for you, and you'll be able to get back out in the fields and do your work. But imagine not needing that Band-Aid in the first place. And imagine how much more efficient you were if your knees weren't hurting, if you had more energy, if you were not winded every time that you were trying to, throw a hay bale, things like that. Not only that, but then imagine also, how are those things affecting your relationships? How are they affecting your ability to be a good husband or wife and father? And you don't often ask yourself that question, because it's almost like this passive experience within a family network. Dad's back is hurting again, he's got to go lie down, that kind of thing. Imagine the scenario where that's not the case, and you're not tired after a hard day's work, and you're able to go, make dinner or have fun with your kids. And so that's the type of thinking that I'm trying to emphasize to individuals, is that no matter where you are in socioeconomic status or job or rural or city, health still remains foundational for what is most important in your life.
All right, and I'll close that up with just saying, having to take a look at Sarah. I mean, she's just living proof that people can change. I used to be kind of critical and saying people can't change, but she did it. She was nearly dead in her 20s, and now she's rocking it in the medical field. So kudos to you.
Yeah.
Go ahead.
Ultimately, time finds the answer for you, right? Sarah and I can both attest to, being with people as they get older, and on their deathbeds. Like, there is that regret, and there's that desire that, I wish I would had better quality time with my loved ones. So time will find the answer for you. Time will make those choices for you in the future. And the point is to try to front run that scenario way ahead of time.
Sarah?
Yeah, I just like the way you talked about it in the book, and we've touched on it here too. It's you can say, hey, I don't want anybody to tell me how to run my life, tell me what to eat, or that I should work out, or I value my autonomy. The irony is that that will enslave you in the end. And I liked how you brought that concept out in your book. You talked about it's actually health capital is freedom. It is freedom from disease. It is freedom from, can't run down to your mailbox to get the mail because you can't breathe. You want to be free of those things when health is wealth. We say that we have these slogans and stuff, but it is so true. And when I'm working with somebody, I will talk about the window of opportunity, because like you said, time eventually does give us the answer. The thing that I think as clinicians in this space is we want to help people understand they have a window of opportunity to change, but sometimes that window will close. That window doesn't stay open forever. And, but we can do a lot. And even making changes when people are very late to the game, so to speak, can make a big difference. So it's never ultimately too late to make adjustments. But when we're thinking of chronic disease and stuff, there is a time where damage is done. And it's sad. Sometimes I've had a patient tell me, "You're the first person I've been seeing people for my diabetes for years, and you're the first person to explain to me that this would happen, that I would have to have dialysis, that I might have to do all this stuff. Nobody told me that. Nobody."
Right.
It would, and that breaks my heart that people are taking risks or throwing the dice, so to speak, if they're with their lifestyle, but they don't even know what they're gambling with. They don't even know what the stakes really are, because that hasn't been told. And I respect people's choice. You say, hey, you want to continue to do this and that? That's fine, but at least know what the dice are. At least know what the outcomes may be. And I think we owe it to people to explain, look, this, metabolic syndrome and these are the outcomes of this that you could be potentially looking for toward the end, if changes aren't made. And so, anyways, it's just such a good conversation to have, and I thank you for the work that you're doing in this area, and you're an inspiration. So it's great. I'm glad to meet you.
Thank you, as you are, Sarah.
All righty, moving right along. So let's see here. Oh yes, as a healthcare consumer, there's good advice, bad advice. What's your advice for the digital age? Everyone and their brother has an opinion. Dr. Google, any guiding principles, how to sift through all this mountain of information?
This is a great question, and it's hard to answer because each individual, I think, is coming at it from different directions. And so you can look at somebody who is just starting out, trying to get lifestyle recommendations, who has never really considered it previously, to somebody who already has and has been living, quote unquote, healthy for years and is wanting to get even more granular on certain things. The recommendations are different there. And so for individuals who are just starting out, don't know what to eat, don't know what to do from an activity standpoint, I do think that, the major organizations and their guidelines are an appropriate place to start. So that's the ADA, in the American College of Lifestyle Medicine, has great resources actually, and American Heart Association. They have general recommendations for healthy behaviors. And I can hear people scoffing right now, but again, you got to understand that most individuals are not shopping at Whole Foods. Most individuals are not eating a whole food plant-based diet or clean in any capacity. It's highly processed foods, the standard American diet. And so switching towards some of the recommendations that de-emphasize those choices and healthier choices is a good place to start. But then you get very lost after that. Well, then where do you go? Which diet is best for me? Do I need to do keto? Should I go carnivore? Should I go vegan? And that's a really challenging position to be in as an individual, as a consumer, because you don't know who to turn to. And that's where I think there's a tremendous gap in the health and medical care that we provide. And it's, one Sarah and I are hoping to fill. There should be a professional you can turn to ask these questions. What do I do now? And so I don't, aside from American College of Lifestyle Medicine, and my book and some of the, the podcasts out there that I like, I think it's okay to get a general idea of what's out there. Explore what people are saying, because you're going to hear very polarizing views. You're going to hear the exact opposite. And so what I encourage people to do is, lean into this idea of, and ask yourself, why are there so many different opinions? And, what is this vegan podcast host telling me to do? And what is this keto person trying to tell me to do? Is there any overlap? Does one sound a little ambiguous and speculative over here and versus over there? Before committing to like any one way of activity or eating, get an understanding of what people are saying, what to do, and just be critical with those recommendations. As a general rule of thumb, for people that who are telling you that there is one way and only one way of doing anything, whether that's being entirely vegan or being a carnivore, they're probably trying to sell you something, and they're probably that's the entirety of their brand. And if they deviate, regardless of what the research says, that's going to clash with what they're trying to sell you. And to me, that's a red flag. Any provider worth their salt, in my opinion, should be able to work with the individual, their goals, their priorities, their past medical history, their socioeconomic status, and where they live, and try to find what is best for them. And that could be a whole food, plant-based diet. That could be somewhere in the middle of, it's still incorporating some animal products, or, while it's not how I practice, if it's somebody wants to do, full on keto and something like that, that's great. But then go in with it with a critical eye, why you're wanting to do that, and then follow your symptoms and your labs over time, with the understanding that those are just a snapshot in time. And people will post their wins with regard to their lab values on, certain diets and doing certain things. And it's like, that's great. I'm happy for you. But these chronic conditions develop over years and decades. And we don't have the research to say that, a carnivore diet or a keto diet is necessarily going to have the same outcomes for the diets that we have decades of research on. And that's more like the Mediterranean diet and the more the vegetarian side of things. And so that's why I focus on that pattern of eating, as opposed to some of the newer styles. So again, just to summarize, if you're just starting out, and that's the demographic I'm speaking to at this point, if you're just starting out, it's okay to look at the professional organizations and their recommendations, whether that's American Heart Association, American Diabetes, and I would obviously also emphasize the American College of Lifestyle Medicine. They have great resources. And then get a flavor for what people are saying about various diets and activity programs for individuals. See what makes sense to you, what might work for you from your standpoint and your goals. Be critical of those things, ask questions, and then it's probably appropriate to get some professional input and go from there with regards to implementing the changes.
Awesome. So you kind of touched on our last question before closing out here, which was all about nutrition. seems like it's not touched on a whole lot in your medical training. And it's one of the 6 pillars of lifestyle medicine. Do you have any thoughts about the 6 pillars on lifestyle medicine? And is there times or emphasis on putting one pillar over another one, or different stages in a person's life? Or any thoughts on that?
So nutrition and exercise are going to be more often than not the biggest emphasis for individuals. And I think there's pretty comfortable in saying that those are going to be a primary driver for one's health over the others, save for somebody is, has a substance abuse problem. You could be, eating a fantastic diet, but if you're, drinking 3 to 5 or whatever, cocktails a night, that's going to be counterproductive. So for most people, we start out with nutrition and exercise and touch on some of the other elements. But as we get the nutrition and activity dialed in, then you start emphasizing the other ones. So it's fine tuning each of those dials over time, starting off with generally what's the biggest bang for your buck, and then emphasizing the others going forward, because it's really hard to cold turkey into all of these things at the same time. It's again about a pattern of living over time and improving those things over time. I am not perfect in any way. I slip up from all the time. I fall off the wagon all the time. But I'm aware of those choices, and I know what they mean, and I get back on the wagon all the time. It gets easier and easier to do that over time. And the point is to give yourself some grace to fail, and know that you were once doing a really damn good job, and that person still exists. That person is still in you, and bring them back out and get back up on the wagon and start again. So the other thing that I'll add is that exercise appears to be additive with those other lifestyle interventions. So if you are increasing your activity and changing your diet, that's better than either one alone, and it can, in addition to some of the other lifestyle factors. So adding in exercise appears to be additive from a mortality benefit, compared to just doing it by itself.
Awesome. I think we can get to closing out here. Let me see what we got here. Is there anything else you wanted to chat about we didn't cover? And where people can find you, if you want people to find you, Twitter or your book, etc.
Yeah, as you have here, my book, Sovereign Health, is on Amazon. And I can be reached through my colleague and I started a lifestyle medicine venture called Sound Lifestyle Medicine, SOUND, lifestylemedicine.com, where we're offering these services to individuals. Currently, we're just have our medical license in Minnesota, Wisconsin, Utah, Colorado, Arizona, Nevada, but we're expanding. We'll be offering courses that can be taken, no matter where you are as well. And so you can find us there. You can reach out. I'd love to tell you more about what we're trying to do. But lastly, I'll also say that, health, again, is this pattern of living, and you don't need to be this quantified self guru to make healthy changes in your life. And so again, it could be something as simple as just adding walking or activity to your daily regimen, all the way up to retreats in Bali. I think people get hung up in this idea of that in order to be healthy, I've got to be shopping at my local co-op and buying all these vitamins and supplements and doing these retreats, and I got to look this specific way. And I'm trying to really remove that veneer, that stereotype, that barrier to entry, so to speak, because again, I don't care what socioeconomic status you are or where you live. There's always something that you can do to better your health, whether that's trying to quit smoking, increasing your activity a little bit more, utilizing some less processed foods. There's always something that could be there. And the point is to try to tackle one of those at a time. And as you start making steps towards that, you can add more in. So you can begin anywhere. As I say, you can get off zero. That's a Bitcoinism, to get off zero, no matter where you are in your life. And I think once you start getting that momentum, it just snowballs from there. And so um, I just wanted to thank you for the opportunity to be on the show. I appreciated the questions, and Sarah, I'm very proud and happy to see that you're doing the work that you're doing, and I hope to maybe we can collaborate one day.
That would be great. Yeah, that would be great.
Sound advice. And in closing, I'll have two things. One rapid fire question. Mark, what's your favorite color?
Blue.
Sarah, what's your favorite color?
Oh man, I hate that question. I don't know. I have so many of them.
You have to answer.
The orange.
All right. And I don't want to deprive the people. I do a little chair spin here. 1 second. Got that out of my system. All righty. And everybody take this opportunity to invest in your health. I am going to end the recording, and if you guys want to hang on a minute, we will have a great day. Touch some grass, everybody.
Thank you.